My boyfriend is passed around multiple times by mid-levels before actually seeing a physician for a proper diagnosis. For context, my so, 34M, has been in excellent shape his entire life, former college athlete, eats healthy, works out, has no health issues, is a non-smoker. He started having problems swallowing and went to see his PCP. He described it as feeling like the food was getting stuck in the back of his throat. He was only able to swallow small bites of food at a time, and with the help of sips of water. After examining him, he was referred by a physician to an ENT. At that office, he saw a PA, who told him that he had a GI issue and sent him to the GI. It took nearly 3 months to be seen at the GI office by an NP who diagnosed him with GERD. Mind you, he has no other symptoms other than he can only swallow tiny bites of food at a time. He is started on famotidine 20 mg bid and scheduled to follow up in a month. The famotidine didn't help his swallowing issue at all, so at the follow-up with the NP, he is scheduled for an upper endoscopy. Endo results are normal except that they found H. pylori on the biopsy. A different NP treats him for H. pylori with quad therapy. He tested negative after treatment, yet he still was having swallowing issues. At this point, I tell him to demand to see the GI physician. He is able to schedule an appointment to see the doctor who had him do a manometry test. My boyfriend finally had his follow-up with the physician yesterday with the results of the manometry, and it turns out that he has cricopharyngeal and GI is referring him back to the ENT. He has spent hundreds of dollars in copays over the past year. I'm not sure if he would have had a different outcome if he had seen the physician in the first place. Nothing major happened, other than a huge waste of time and money. Thanks for listening, I just wanted to vent about it. Optometrist diagnosed my dad with an optic nerve stroke and sold him vitamins. Mid-level patient cases. For context, I'm an MG3. Last night, my dad tells me he's been having trouble with his vision in one eye. It started 2 months ago, and now he estimates his vision is about 30% compared to his other eye. Clearly, we are not to go to the doctor family. At his regular PCP, MD, visit, he mentions this to his doctor. They send him to an optometrist because they think it could be cataracts. Based on what my dad tells me, the optometrist did a dilated eye exam, checked intraocular pressure, and at the end of it said you had an optic nerve stroke. He then sold my dad vitamins to support your immune system and said he could follow up in 6 months. My dad is not medical and more or less does whatever his doctor tells him to do. I got in touch with his PCP and helped arrange next day follow-up with an ophthalmologist. This optometrist did 1. No further workup for causes of painless vision loss in a 70-year-old. 2. Did not think it was important to prevent further vision loss if it was in fact ischemic vision loss. 3. Did not communicate these exam findings back to the PCP. 4. Sold him fucking vitamins. I am an M physician. I am not an expert on the eye. If this person comes into the ed, I am talking to ophthalmology to make sure they have follow-up before I send them home. Full takeover. 1-to-1 replacement of do with NP. Mid-level ethics. The NP is even called doctor, as in your new doctor will discuss medications with you. I am also an NP and graduated with my new provider. That won't be weird. To be fair, I do not know her position on this, but the company is all in. PCP left because of patient overload and refusal to bring in another MD. They are literally exchanging a do for an NP. Up shit stream with no oars. I have the actual letter from the office with this exact wording but can't seem to get it approved, even redacted. Seeing PAs generally has been costly and very painful for me because they miss things or misdiagnose. I've now ended up in the emergency department twice after a lack of urgency or proper diagnosis by PAs. How can I prevent this from happening in the future? Mid-level patient cases. Example 1. I present with 750 milliliters of fluid and a pleural effusion and partially collapsed lung 2 weeks post-open heart surgery. I had a congenital condition repaired. The PA sends me home with pain meds. an X-ray, and an order for consult with radiology. Radiology doesn't call me, I call them and am told it's a 2-week wait. I go to my primary and he send me to the ED. Tap is done at the ED the next day. Slight pericardial effusion which does not need draining, 10/10ths pain like nothing I have experienced in my life. Example 2. I present to the urgent care PA with flank pain, 7 months after open heart surgery. X-ray is ordered, I am told it's cartilage inflammation of the ribs and I could go work out that day if I could tolerate the pain. 6 days later the pain is so severe I am crying when the Tylenol wears off after 5 hours. I go to the ED and it turns out I have a kidney infection. I am administered 4 antibiotics. A CT is done of my abdomen and chest to make sure there are not any blood clots given my history. Fortunately there isn't any kidney damage. This has been exhausting and expensive. I've been ruined. Going for a walk with a friend who's going into an RN program, with the end goal to become an FNP. She told me I'll be a doctor and my stomach clenched, but I kept my big mouth shut. Once she said that FNPs are basically the same things as doctors, my big mouth held it down for you all, explained the difference in scope of practice, educational requirements and told her not to say that in front of doctor. Now I have another thing that will bother the SHT out of me for life. You all have ruined me with your knowledge, damn it. Fake nursing degrees are a small portion of the problem with nursing education. Mid-level education. Recently news reports of Operation Nightingale have indicated that at least 7,600 nursing degrees were purchased without any education, and the purchasers were allowed to take NCLEX nursing boards. Many passed and are now practicing on patients without ever going to a nursing school. This is obviously, if it is as the authorities portray it, a blatant fraud. This will be relatively easy to prove in court. There is little question that some of these 7,600 will have gone on to be certified as nurse practitioners, and some will be practicing on patients without supervision, as this is allowed in 26 states now. As horrible as this is, those familiar with the nursing landscape know that this is just the proverbial tip of the iceberg. There are less gross, and therefore perhaps less prosecutable, examples of cheating on NP education which those familiar with nursing schools and nursing regulation are very aware of. Few of these are pursued. Here are some of the categories of misconduct that are there for the finding. Unproctored nursing exams which tacitly permit cheating. Students who fail exams and are given the opportunity to repeat until they pass. Students who are given tests composed of exam questions they have already been given in the class materials. Students who fake clinical hours, and even forge preceptors' signatures. Boards of nursing ignore reports of issues with nurses. Then there is another layer of somewhat less egregious misbehavior. Students who are required by their schools to find their own preceptors are desperate to find anyone to precept them, and so are happy to find clinical experiences which are not helpful in teaching them what they need to learn to do their jobs. Examples of NPs who have never learned to do female pelvic exams, as one example, are not hard to find. Preceptors who have incompetent students, fail them, only to find to their horror, that the school passes them and graduates them. It should be noted that nursing students learn by observation, and if they observed that purchasing diplomas is acceptable, then, rationally, they can use all the other methods of getting certified without actually learning. It is stunning that this involves 7,600 people at least. A fraud of this size cannot have gone unnoticed. Yet we are just now learning of it. Other frauds on patients are occurring as noted above, and are common knowledge, but there is little or no activity to control them. Why not? What I have written here is actually non-controversial among those familiar with the nursing education landscape. It is hiding in plain sight for many reasons, most of them revolving around money. No one wants to address these, and the few who do are attacked. _ETA. I know there are a number of NPs or NP students here. I encourage you to add your experiences, if they are similar to what is written above, or if they are different, either way.